Hello, my name is Hervé Saint-Louis. I'm an assistant professor of emerging media at Université du Québec à Chicoutimi. And today I'm going to be presenting on perception of security risk related to contact tracing technologies. Now, as we've all seen, contact tracing technologies have been used recently, have been proposed as a method to control for infection during the COVID pandemic. So I'm going to touch a little bit more on that, but I'm going to go back into what exactly is contact tracing, a little bit of the history, some of the hurdles, some of the problems that we may perceive, that we may see, before we finally go into starting to look at what end users on social media, in this case, have been saying about contact tracing apps. Specifically, the focus is going to be on Canada and Canadian apps, mostly. So the theoretical approach I'm using is Ulrich-Beck's Risk Society. So Professor Beck wrote in his classic book that security and other risks are all man-made. And what they do is that they create a lot of stress in societies, in humans, in people. And there's always a potential harm. And there's an omnipresence of news. And there's like a risk distribution of all this risk, which is all man-made. Epidemics are part of this, but also information security is also something that I have added in my research as part of those man-made risks that are pitting us in what Beck called the risk society. So as you listen to this presentation, my theoretical perspective, position, is really going to be oriented based on Mr. Beck's work. Before we go forward, there's a famous apocryphal quote by Benjamin Franklin, which is, "Those who would give up essential liberty to purchase a little temporary safety deserve neither liberty nor safety." Like I said, it's apocryphal, so we don't exactly know if Franklin ever said that. But what this quote has been used over the years to say is that we should not give up liberty in terms of for security, and sometimes also been used for privacy. One of the questions that has been asked with contact tracing apps is whether the government will look into our data, our location data, and so on, whether the government will infringe on the privacy of Canadians in order to maintain security, in this case, health security. So our contact tracing app worked the security hurdle. As Renaud wrote way back, technological security is only as strong as the weakest link. In this case, we often say that the weakest link is people, the human security. Usually when we talk about security, we want to make sure that security is people-proof, because if people don't participate in the security, no matter what technological system that we use, no matter what policy that we use, it will always fail if people do not participate. As you can see in this example, you've all seen this example around you of people wearing their mask improperly. So as we say, if one of us is not wearing the mask securely, none of us are safe. So in terms of the study background, it's a preliminary study, and it's ongoing, that is looking at Canadian perception. It's a qualitative sampling at this point of mostly English language tweets between January 1st and October 16, 2020. There is no extensive coding yet, and no network analysis has been performed on the participant, which are all Twitter-based. There's no IRBs that was approved for the interview as of today. And so I could not even start participant recruitment in order to do interviews with selected people. So all of the data I've got right now comes from social media, Twitter in particular. One thing that we need to understand when we work with the social media user is that we have all the potential app users here of this app, which means anybody in Canada who downloaded the COVID Alert app, social media users, and then we have the active social media users. And those are the only ones that we can look at in terms of this study right now. Usually when we talk about social media, we have three types of users. We have the hidden ones, people who are just sampling or just looking. We have those who obfuscate their identity, so we cannot tell who they are. And then we have the revealed. We have people who do give us their identity on social media, so we know who they are. Most of the studies, usually when it involves social media, we can only look at those people because we know that they are real humans, they're not bots, they are not people from other countries pretending to be Canadians and so on. Even in the case of those revealed users, we cannot always say if they are Canadians or not. So the history, in terms of contact tracing history, it's a practice that's been used all the way back to the Middle Age during the Black Plague, when houses were marked as contaminated and so on. In the 19th century, John Snow developed contact tracing practices in order to measure the cholera outbreak in London. It was also used for the tuberculosis crisis in the 19th century in Europe, Canada, the United States. And reporting was mandatory. In the 1920s, following World War I, contact tracing has shifted to something that would focus on venereal disease, mostly because of the soldiers who went overseas. So a lot of the targeted groups that were looked at this point were prostitutes or soldiers, which involved then public shaming of the promiscuous sex practices of those people. So contact tracing has been very successful since in controlling diseases like infection, like the smallpox in the early 1980s. There are other infection practices that are often used to mitigate infectious disease propagation. So contact tracing is only one of them. Contact tracing is also an approach that is based on social network analysis, which means that we look at a network of people and their link to one another to see who has contacted whom, and is this person now in this other person's network at risk of transmitting this infection to other people. There are several types of contact tracing. We have what we call active contact tracing. This is when health officials warn contacts that were provided by what's called the index. The index is the person who transmit the disease to others. So the index will tell us about who are the people in their network, and authorities will contact each of them. This is called traditional contact tracing. There's limited contact tracing also when we notify individuals who might be unaware of infection risk. It's often used for a large population, let's say a school or something like that, a dormitory. We also have what we call voluntary contact tracing. This is when the index is encouraged to identify all of their contacts. Some of the methods that are used for contact tracing are interviews, narrowcasting. This is asking a sample of at-risk population to get risk. So in this case, a dormitory, we could say all the students in this dormitory are encouraged to get tested. There's real-time detection, which use several techniques, like even CCT, TVs, facial recognition, signal tracking from cell phones put in people's environment. Those are usually what we call intrusive approaches. There is what we call sensor-based. Sensor-based is what we mean when we talk about smartphones. There are some historical concerns with contact tracing, which in terms of the target groups that are often verified or checked. Prostitutes, immigrants, gay men, when we talked about HIV, racialized minorities, and so on, which means that there's a history of people being reluctant to disclose their status in terms of infection for fear of discrimination. Because in the past, specific measures were used against those populations. In some provinces, it is obligatory to report infection to authorities. So a doctor, a nurse would have to report and tabulate all of the infection of the patient that they deal with. Anonymous testing in the past was prohibited in some provinces, which discourage people to get tested. So when we talk about sensor-based detection, they've been used mostly in the Ebola epidemic crisis in West Africa. There's a process of registering the user to contact the user if there's a positive match, and then the infection report, which is used by the authorities. There are limits to contact tracing when it's sensor-based. So we need at least 60% of the population for it to be effective. In terms of the technology that's been used here, Bluetooth, it has a limited range, so it is not foolproof, which causes false positives all the time. Also, in terms of the solution that's used here, phones that are older than 5 years cannot use the app, which means that people with older phone models, often disadvantaged populations, cannot be part of the loop. So they're not being tested. There are many protocols that have been used to do contact tracing. Singapore was the most advanced quality in that sense. There's the DP3T that was used in Europe, and then there's the Apple and Google decentralized system, which does not keep personal data. Contact tracing, in this sense, has become a digital practice. It used to be just another medical or practice, but now it's become a digital practice, which is changing in terms of who's performing the contact tracing. So instead of being something that is mediated by health professionals, it's something that is now sent to people. People now have control over, by using the apps, who can reveal their status and so on. One of the things which is problematic here is that the cell phone is a technology that's been used that is close to people. The cell phone is, you could say, is an extension of people's lives and so on. And so when we use a technology like contact tracing, we are asking people to use something that is personal, that is part of their construction, what I call the co-construction of their identities. We are asking them to reveal a lot about themselves on this device, which they consider part of themselves, which could explain part of the resistance to the adoption of this approach. So I'm not going to spend much time here. It explains in terms of a cartoon that was used and broadcast how contact tracing works. What we need to know about the Canadian COVID alert protocol. It is based on the Apple Google framework using Bluetooth technology. User receive a positive code, data remained on the user's phone. So there is no central database for this. Users participate voluntarily in this thing, and they have to submit their status. If they do not submit their status, nobody will know if they're positive or not. One of the issues we have, even with the Apple Google approach, is that none of them are foolproof. If I were very proactive as an hotel, I could install phones and triangulate inside of my hotel, or have my staff walk with phone all around and triangulate people, which would mean that at the end of the day, it's possible to determine people's identity. Same thing if you put a bunch of phones in a public space. You could, like in a mall, you could eventually determine who exactly is contaminated or not just by triangulation. So there is absolutely no contact tracing, digital contact tracing approach, which is completely foolproof in terms of protecting people's identity. Someone who's very enterprising could determine who is infected or not, but it would take a lot of effort to do so. In terms of the Canadian apps, we have a patchwork of contact tracing apps in Canada. While the only province who did release its own app was Alberta on May 2020, but the app is buggy. And because the Google Apple framework only support one app per country, they decided to support the federal government's app, not the one from Alberta, which means that Alberta could not fix its app. Ontario was the first province to join. Other provinces have joined so far. The only two provinces who are still not in the system right now, if we exclude the territories like Yukon, is British Columbia, which only has a news app that informs people about what's happening with COVID, and Alberta, which said it was going to join, but still has not committed to that yet. In terms of the results of the preliminary study that I've done, if I look at when I looked at tweets from January 1st to March 30, 2020, the classical definition of contact tracing was still used in people's tweets. There was no mention of user-based sensor technology until Singapore, as an example, came up. There were some comments from experts in the media urging for people to use contact tracing for governments to use it. And many respondents were asking for government to speed up the process of introducing app-based contact tracing. If we look at the results from April 2020, there was an initial positive review by expert, obviously, of the Apple-Google protocol. Again, people were urging governments, authorities to deliver the app as quickly as possible. There were a few doubts about the efficacy of the contact tracing apps, and there were some comments about surveillance, fear of surveillance. They started to come around there. In terms of May, this is when we started having a bit more negative messaging, even in terms of Alberta, because Alberta's app was the first one, it was the first to be criticized. And many of the comments were in terms of security, in terms of privacy, and obviously government surveillance. If we look at again, May-June results, we can see that one of the big issues that happened on June 24, after the federal government announced its own app, was that there was a fake app, a fake contact tracing app for Android that was released. The problem with things like that is that it shook people's confidence in the federal app. If now you know that there are fake contact tracing apps in the App Store, this is not going to encourage people to adopt the app. And at the same time, the privacy commissioner of the provinces and the federal one also warned different governments about not instigating security protection within the apps. If we look at June and July results, in July, the federal government opened its beta testing for the app. In August, there were some complaints from users from provinces that are not participating yet to please have the app in their own province. So many people have downloaded the app, but it will not work unless your province has green-lighted it. We can still see that the traditional or classic meaning of the term contact tracing was still used as far back as August. And we can also see from some of the comments that there was a lot of Canadian pride in some of the users that I sampled about the fact that Canada was one of the first countries to deliver the app, but also open source and put the code of the app, make it available for any other country who would want to use the protocol, everything that was developed around the app, making it easier for some countries to develop their own apps. In terms of September and October, what we have is that we can see that because there were no direct feedback from the app, that people are not even thinking about the app in terms of something being useful for them. There are still users from some provinces who still want to join in, and we still have there's still conspiracy comments. I don't think they're going to go away, but we have authorities trying to get people to use the app and people responding to that. some of the implication about this is that the classic concern of stigmatization in terms of contact tracing still remain. We can see that users with higher level of digital literacy are probably more prone to use the app. In terms of having digital literacy, if you have a newer phone, chances are your digital literacy may be a little bit higher. Not always, if you're a new user, but it may be higher. So if you do not have the latest phone and you cannot download the app, it does limit if you can use it. Anonymization is still something that people are debating. So there are still privacy concerns over the app, and people still think that it is a surveillance problem, that the government may have access to this. Like I mentioned, it would take a government, an organization, a lot of effort in order to capture all of this data. So the effectiveness, because there's no direct feedback from the app, people kind of think that, well, is it doing anything? And we still have problems of, in this case, the Canadian classic jurisdictional problem of public authorities per province have to approve the app or not. And this is one of the main problems. Coupled with issues we have with wearing the mask and other measures to control COVID, there are a lot of problems involved in terms of making contact tracing apps more to encourage their use by the population. There's a lot of differing messaging around, which I would say everything related to COVID in terms of messaging is usually a big mess. So contact tracing apps are part of this big mess. So with so many different messages all around the place, it's not very helpful it does not encourage people to adopt those apps. And this is all I had to say. Thank you very much.